5, 4, 3, 2, 1.
Hello, and welcome to the Everything Medicare Podcast. I'm your host, Christian Brindle, and here at this podcast, we talk about your Medicare, Medicaid, Social Security, retirement, and everything that has to do with everything that goes with that twilight time, the twilight years of your life when you enter into retirement. Like I said, my name is Christian Brindle, and this is our pilot first ever podcast episode of the Everything Medicare Podcast. A little bit of my background about me, for those of you who might not know who I am. I'm an author of 2 books on Medicare. I'm an owner of an independent company that works and helps with folks on Medicare of all kinds, all different situations in Sandy, Utah. For those of you who don't know, Sandy is right outside of Salt Lake City. For those of you who are not familiar with the Utah area, the name of our company is Christian Brindle Insurance Services. It's a company that's created by me, but it's a subsidiary of a larger company that my father owns. I grew up around the Medicare industry. My father has been working with people on Medicare for over 30 years. So I had the benefit of being able to be taught by someone who's very, very, very experienced. A benefit that not many people have, but not to worry. My goal and my mission in life is to pass that information along back to you so you can make a smart and informed decision. And today we're talking about Medicare. Today we're talking about Medicare and introducing you into the basics of Medicare. What is Medicare? Well, let's start from the beginning. Medicare is a program that started in 1966. Now, before Medicare took place, a lot of people asked me what health insurance looked like, and it didn't look good. Before 1966, health insurance companies, similar to how things worked when, before Obamacare came around, and we'll talk about Obamacare in later podcast episodes, but basically what we were looking at and what we were dealing with was insurance companies had all the power. They could accept people or not accept people. They had health questions, underwriting, and they could even not take people based off of age if they wanted to. They had all the power. So that because of this, in the 60s, at that time, before Medicare came around, 60% of seniors had health insurance. So more had it than didn't, but that left 40% of the population, of the retirement population, that didn't have any health insurance at all. And it was a catastrophe. It was a real problem. So in 1966, Lyndon B. Johnson, President of the United States at that time, came up with Medicare and put it into place, the Medicare Act. Basically, if you've ever worked in the United States of America for an extended amount of time, you've noticed that throughout your working life, they've been taking out taxes for what's known as FICA. FICA is Medicare, and Social Security taxes. Now, Social Security, we're not talking about that. We're specifically talking about Medicare here. So they've taken out a portion of these FICA taxes for specifically Medicare. And so basically, when someone reaches the age of 65 years old, they're eligible to qualify for their Medicare, something that they've been paying for their whole lives. A lot of people don't even know what Medicare is, and that's why we made this podcast for you. When you turn 65, you're eligible for Medicare. And, well, you can get it before 65 too, in certain situations due to disabilities and things like that. But we're just going to talk about normal situations, like when you turn 65, how Medicare works and how everything works with that. And basically, it's something that you've been paying for your whole life. The government looks at it like, we're not capable of handling our own money, so they take it and they'll give it back to us later. So that's Medicare works similar to Social Security in that regard. And we're going to get into that more, the specifics, what Medicare is, what it comes with, what it looks like, how much does it cost you anything, if it does, how much, and what products go with it in our second segment. Welcome back. This is segment 2 of our pilot episode of the Everything Medicare Podcast. Episode 1, what is Medicare? This is segment 2. So we talked about in segment 1 the basics of Medicare, how it came to be, how old you have to be to qualify for it. But now let's get into the specifics of how it actually works. So there's different parts of Medicare. Most people are familiar with hearing about Medicare Part A, Medicare Part B, Medicare Part C, Medicare Part D. And for a lot of people, it gets incredibly overwhelming and confusing. But it's not. It's the information is presented out there by the government in such a way that is so confusing that it sounds a lot worse than it really is. It's really not, I promise. And I'm here to show you that what I'm saying is correct. It's something that's easy to wrap your head around. It's something that's simple and easy to understand if the information is presented right, like what I'm doing right here. So let's jump into the basics of Medicare. So let's start with Medicare Part A and Medicare Part B. So Medicare Part A and B are the only parts of Medicare opposed to popular belief or misconception. They're the only parts of Medicare that actually come from the government. They're provided from Medicare. They're issued through Social Security. And together, Medicare Part A and B give you medical coverage, hospital bills, doctor's office visits, surgeries, MRIs, tests, things like that, right? Now, Medicare is probably the most one-dimensional type of insurance on the planet. It will cover only medical bills on its own. There is no gray area, so that means it doesn't come with prescription coverage, dental, vision, hearing, anything other than that. So we'll get into that stuff in a second here. But we're just talking about A and B right now. So Medicare Part A and Medicare Part B work something like this. So as long as you've been working in the country for at least 10 years of your life, paying into FICA, Social Security, Medicare taxes, which if you're working for an employer, they do it for you. They do it automatically. It's not something that you had to specifically do. And most people, that's kind of the category they fall into. As long as you've been paying into FICA for at least 10 years of your life, Medicare comes at no cost. I'm going to say that again. Medicare comes at no cost as long as you've been paying into Social Security, not Social Security, Social Security, Medicare, FICA for at least 10 years of your life, as long as you've been working for at least 10 years of your life in the country. And I'd say 99% of every single person I've ever worked with falls into that category, and I'm assuming most of the people listening to this right now have as well. So Medicare Part A comes at no cost. Medicare Part B, on the other hand, it has a premium attached to it. Now, that's the same premium no matter where you might be, what state you might be in. It's the same across the country. It's a national rate. So that's $134, okay? $134 for Medicare Part B. Now, another thing that's prior to popular belief, there is a way to postpone Medicare 65. Let's say you have a really good health insurance. You pay like $100 or less a month, something, and it's just really good coverage. It's covering things that Medicare wouldn't, prescriptions that Medicare wouldn't. As long as you're working, now listen to what I'm saying here. Listen very carefully. It's important that you grasp this. As long as you're working, and as long as you are receiving benefits through your employer, so a retiree plan wouldn't count. You have to be working actively. You're able to postpone Medicare because Medicare looks at your group plan as credible coverage. And you can postpone it with no punishments, no penalties whatsoever. Now, if you don't take Medicare at 65 and you don't fall into that category, they will penalize you if you take it later. And we'll talk about that in a later episode. I'm just getting into the basics right now. I'm not trying to overwhelm you. But that is an option. So assuming that you don't have an employer plan, or let's say you do have an employer plan but it's not very good, this is what your options are. So there's two ways you can go with your Medicare, okay? I'm just going to get in a little bit of this. But basically, you can take a Medicare supplement with a prescription plan, or you can take a Medicare Advantage plan. So let's start with the supplement. So the way Medicare works, it gives you medical coverage, A and B together, through the government. But the way that medical coverage works is you end up paying 80% of the bills. Well, oh my gosh, it's been a long day. They pay 80% of the bills, and you pay 20% of the bills. Now, Medicare is one of the few health insurances in the world that doesn't have maximum out-of-pockets, meaning that there's no limit to how much you can pay on that. I really need you to get this. There's no limit to how much you can pay of that bill. So let's say I'm a Medicare. I fall, I crack my head. I go to the hospital, I spend a week. The bill's $100,000. They do all kinds of tests on me. Well, they're going to pay $80,000 of it, 80%, which is good, but I'm stuck with 20%. $20,000. There's no limit to how high that could get. It could be $1 million bill. You're stuck with 20%. Now, there's other specifics on how Medicare covers. Sometimes there's deductibles that come into play, but basically after those things are met, then you have the 20% coinsurance. So, and like I said earlier, it does not give you prescription coverage, dental, vision, hearing, and that's a problem. So, they came out with what's called Medicare supplements. Some people call them Medigaps. You might be familiar with them. Medicare supplements or Medigaps fill in the gaps of Medicare. So that 20% they don't pay, the Medicare doesn't pay, the Medicare supplement will. And you pick those up through private insurance companies. Now, in order for the supplement to pay on a bill, a claim, Medicare's got to pay first. Medicare pays, supplement pays. Medicare doesn't pay, supplement doesn't pay. It's a copycat insurance. Think of it like that. And so that takes care of the medical. You have great medical coverage in that situation. But then you still don't have prescription coverage. So they came out with what's called as Part D. You hear Part D thrown around a lot. D stands for drugs. Simply put, pharmaceutical plans. D for drugs. Drug plans. They're also picked up through private insurance companies, and it's a separate policy altogether. So it depends on where you live. You know, every single market, it depends on how much those could cost. Each state has a different market. You got to understand this. And prescription plans, I'll just give you an example. Like where I live in Utah, an average good roughly cost could be $25 a month. It could be more, it could be less, depending on what you need and the insurance company that you work with. But that's what you're looking at. $25 roughly in my state. It could be more in your state, wherever you may be listening from. And so basically you have the three insurances you're working with. Medicare acts as your primary for medical. The supplement acts as a secondary for medical, and the Part D plan is for drugs. D for drugs. Prescription program. So basically that's what you're looking at. That's one way you can go with your Medicare. The other way is you can pick up a Medicare Advantage program. Some people call them Part C. Now this is where it's going to get a little confusing. So I need you to really stick with me on this one. Medicare Advantage plans, think of it like this. You still have your A and your B. They still stay active. You still pay the $134 for Part B unless you're in a higher tax bracket and you're so fortunate enough to be in that position. You still have your A and your B. You still keep paying for your Medicare Part B premium. That part does not change. But instead of running your Medicare through the government, folks, you run your Medicare through a private insurance company. And these programs have been around for about 12, 13 years now. They had a history before that, but we're not going to talk about that today. And they have taken the country by storm. I'd say 70% of people in most markets are on a Medicare Advantage plan, opposed to a Medicare supplement. That's how popular they are. It depends on the market, but most markets, that's probably what you're looking at because they're so popular. And kind of the way they work is doctors refer to them as replacement programs. Now, they don't like me saying that. Medicare doesn't, I should say, or any of the insurance companies, but listen closely to what I said. I didn't call them that. I said that the doctors call them that. And I think it's a good analogy. The doctors call them replacement programs. It's like a nice analogy to look at it. They replace your Medicare. Think of it like that. They take the place of Medicare. They become your primary insurance. So you pick an insurance company in your market. They become your primary insurance, and you run your Medicare through them. Now, Medicare no longer has to pay that 80%. So that's a huge burden off their shoulders. I'm sure most of you can agree. In exchange, Medicare is going to fund this insurance company every month to take care of you, to pay your claims. And so because of this, Medicare Advantage plans in most areas are very low cost. And most areas, there's at least several plans that have no premium at all. And if they do have a premium, they're low, $20, $30, $40 a month. But most places have at least a couple $0 premium plans. So you keep paying the $134 for B, and potentially that's it. Medicare Advantage plans are neat, and they combine your medical coverage, prescription coverage. They give you dental, vision, hearing. Some of them do anyway. Extra benefits that Medicare doesn't pay for, and there's a lot of gray area, and there's a lot more of a diverse array of things they'll pay for that Medicare won't. But like everything, both sides have their good and their bad. That's what I'm always telling people. And we're going to talk about that more in the third segment. Stay with me. Hello, and thank you for sticking with us for our third and our final segment of the Everything Medicare Podcast. I am your host, Christian Brindle, Medicare expert, author of 2 Medicare books, and we're going to wrap up this episode, our pilot episode, our first ever podcast episode. This is so exciting, and I am thrilled that you're here to experience this with me. I feel like we're connected. Wherever you are, I feel the connection between us, that we're experiencing this together. But I gotta control my emotions and get myself in check, because I got a third segment to finish up with you. So we're talking about what is Medicare, Medicare basics, Medicare introduction. Basically, in the last segment, we were talking about the different types of plans. So we had Medigap's, Medicare Part D, Medicare Advantage programs. Basically, what I'm going to wrap it up by talking about specifics, okay? Every person is different. Every single one of you has different needs, preferences, things that you need covered, things that you don't need covered, prescriptions that are different from one another. Some take a lot of prescriptions, some take no prescriptions. Some are in different health situations. And you need different things. Some of you need dental. Some of you never need dental. Some of you need crowns. Some of you need cleaning. Some of you need nothing. Some of you do your own dental. It just depends on who you are. And because of that, there's advantages and disadvantages, no pun intended, to the Advantage programs and the supplement route. You can't do both together. You have to pick one or the other when you are getting onto Medicare. Those are the 2 routes you can go. And as complicated as they make it sound, when you break it down as 2 choices, it really simplifies things. And in my opinion, if you can determine which one's better for you, going to supplement and Part D route and the Advantage plan route, that's 60 to 70% of the battle right there. Honestly, it's as easy as that. You're welcome. We just simplified this puppy dramatically for you. And we're going to be coming with lots of more free information, but just keep in mind, everybody's different. Not one plan is better than the other. The supplements aren't better than Advantage plans and vice versa. They both have their strengths and their weaknesses about them. And depending on who I'm talking to will determine which plan I'm going to recommend for somebody. So that's why it's so important, I can't stress this enough, to work with somebody on your Medicare plans. Because unless you really don't have in a life, you don't have time to research all this stuff. You don't have time to look at every plan. You don't have time to educate yourself that dramatically. I encourage you, work with someone good in your area. Now, there's a lot of bad agents out there too. Make sure you find a good one. I really mean that, because a good agent's going to take care of you. A good agent's going to work with you constantly. A good agent's going to recommend a good plan too. They don't want to, there's all types of benefits to working with a good agent, but if you work with a bad one, you might as well have not worked with one at all. So I encourage you, in your area, find an agent to work with. If you're in the Utah area or in the Florida area, I can help you. Call my office at 801-572-3808, 801-572-3808, and ask for Christian or ask for one of my assistants, and we can help you if you're in those areas. Those are the areas we do business in. Now, that will expand in years to come, but for now, that's all we got. But I'm an expert in Medicare. There is no one in my area better than me, my opinion. I have to say that legally. But another thing, if you like this information, if you found this information beneficial, and you want more detailed information, and you just want to understand this stuff, we came out with products and content just for people like you. Like I mentioned, I'm an author of 2 books that have to do with Medicare, and I'm going to talk about one of them today. This is the Medicare Guidance, Picking the Plan for You. I'm holding it in my hand right now as we speak. And this book is awesome, guys. This is the first book I ever wrote on Medicare programs, and it's spectacular. It's a red book, blue on the back, and it's 50 pages, an easy read, big font. And we did it that way because we just wanted there to be no fluff. 90% of people in the United States of America that start reading a book each year don't finish it. And I never wanted people to associate my name with a book they didn't finish. I wanted it to be easy to read. There's no excuse. Guys, this book talks about everything you need to know to make a good decision, an informed decision. You need this book if you really want to know what to do, what not to do. It's $5 on Amazon right now, and for that price, I'm practically just giving it away. We don't have this book out to make money. If we did, we could charge a lot more from it and still sell it. But that's the minimum price they would allow us to charge over at Amazon. But basically, guys, for $5, this book can save you hundreds, even thousands of dollars a year in picking the right insurance that's going to pay what you need it to pay or save you money in premiums. It's a steal at that price. It's a no-brainer. Go over to Amazon, type in my name, Christian Brindle, B as in boy, R-I-N, D as in dog, L-E, Brindle, and pick up the Medicare Guidance book, Picking the Plan for You. I personally guarantee that you won't be sorry. And without further ado, that brings episode 1, our pilot, What is Medicare, to an end of the Everything Medicare Podcast. I appreciate you listening. I appreciate you giving me some of your time and spending some time with me, because I'm lonely. I love spending time with you. I don't got anybody. That's not true. I'm married, folks. But still, I love spending time with you. Don't take it that way. Thank you for being with me. Every single Monday, we're bringing you a new podcast. We'll see you next week.